The federal government will partner with New York to build two mass vaccination sites in the New York City area aimed at getting vaccines distributed to minority communities. Joining us right now is Dr. Atul Gawande. He set up the mass vaccination sites in the Boston area at both Gillette Stadium and Fenway Park. Dr. Gawande is also a surgeon at Brigham and Women's Hospital and a New York staff writer. In fact, his piece in the current issue profiles one North Dakota community that was hit hard by the COVID crisis. Atul, good morning. It's good to see you today.
Great to see you, Becky.
Why don't we start with those mass vaccination sites that you've set up? How are things going so far, and where do you think the problems are?
So we've had a gradual start, with planning really only starting around Christmas to get them launched. But at this point, we're up past 5,000 shots a day across our two sites,
Wow.
Opening a site at Reggie Lewis Track and Field that will also accelerate. And we're basically seeing across the country mass vaccination sites have helped us get to the point where at 4 times the rate of vaccination per day, over 1.5 million shots per day. Now, what's not working well?
That's great news. That's great news.
It is. And that will continue to climb. What clearly is the challenge is that these mass vaccination sites are not everywhere. And there are major community holes where we're not reaching enough people and have to have added solutions, including new sites, but also creative approaches to bringing people in.
Just in terms of how much demand there is versus the supply, Scott Gottlieb has posited that he thinks maybe by April we'll start to see a flip where we have more supply than demand. I hope that's the case, because there's still a lot of people who have no chance of getting a vaccine appointment anytime soon.
It's certainly the case. We're reaching the point where I think the ability to administer the vaccine is growing steadily, and we're hitting the bottleneck of supplies not being able to keep up with the number of appointment slots that we can create. At this point, we in big sites can increase the schedule if there was more supply. Now, I would love to see that the production get to the point that we have oversupply for where we are. If we see the Johnson & Johnson vaccine approved in the next couple of weeks, that will open up a new channel. And there's, 2 more vaccines that have good preliminary clinical results that could be coming in the next month or 2. And that will be a big deal, having 5 different vaccines.
What are the other 2?
That would be AstraZeneca and Novavax.
Yeah. All right, we'll cross our fingers on both those counts. Dr. Gawande, you wrote in the most recent New Yorker about a small town called Minot, North Dakota. Why did you pick that town?
I was interested in it because North Dakota in the fall had become the place with the highest rate of cases, hospitalizations, and deaths per capita. And Minot was the hardest hit county and the hardest hit state in the hardest hit country in the world. And what I wondered was, what is keeping us from coming together? Can democracy succeed in helping, in enabling us to get things under control? And I started tracking things as things got worse. And, I highlighted a couple of people on the city council, one who proposed a mass mandate when the state wouldn't do it, a woman named Carrie Evans who had multiple sclerosis and medications that put her at great risk, and a guy named Tom Ross who was strongly anti-mask. And, my conclusion was, it's ugly. We don't all pull together. Consensus isn't possible. We are frayed as a democracy, but it worked. And what you saw in the community was the mandate came through at the local level. Eventually the state did. It was only when the disaster was really upon them. But at that point, North Dakota got to 89% of the population wearing masks most or all of the time, and the tide was turned. And
the key being when people knew people who were very sick or who died, that maybe changed their minds?
Certainly the case. It's not that it necessarily changed people's minds. Some of the people I profile had family members who became extremely sick or sick themselves, but were willing to make the trade-off that if people were going to get sick, they wanted the freedom to have life pretty much as normal, even if that was the cost. But the bulk of the society looked at that and said they weren't willing to pay that price and voted and backed the representatives who called for the masks to be instituted and limits on restaurants and bars put in place. You never get to consensus. The debate doesn't stop,
right,
but it does work.
Shepard Smith here. Thanks for watching CNBC on YouTube.